This is USMLE QA, USMLE material presented in a question and answer format structured similar to the first aid for the USMLE Step 1 book.
Question: What is the mode of inheritance for autosomal recessive disorders? Answer: Autosomal recessive disorders are inherited in a pattern where two copies of a gene, one from each parent, must be altered in order for the disorder to manifest. Question: What is the chance of a child being affected if both parents are carriers for an autosomal recessive disorder? Answer: On average, each child has a 25% chance of being affected, 50% chance of being a carrier, and 25% chance of not being affected nor a carrier. Question: What is a common cause of autosomal recessive disorders? Answer: Autosomal recessive disorders are often due to enzyme deficiencies. Question: Are autosomal recessive disorders usually seen in only one generation? Answer: Autosomal recessive disorders are commonly seen in only one generation. Question: Are autosomal recessive disorders more severe than dominant disorders? Answer: Autosomal recessive disorders are commonly more severe than dominant disorders. Patients often present in childhood. Question: Is there an increased risk of autosomal recessive disorders in consanguineous families? Answer: Yes, there is an increased risk in consanguineous families. Question: What is the probability of an unaffected individual with an affected sibling being a carrier? Answer: An unaffected individual with an affected sibling has a 2/3 probability of being a carrier. Question: Is there a way to diagnose autosomal recessive disorders? Answer: Genetic testing and family history can be used to diagnose autosomal recessive disorders. Question: What is the treatment for autosomal recessive disorders? Answer: The treatment for autosomal recessive disorders depends on the specific disorder, but may include enzyme replacement therapy, dietary changes, and gene therapy. Question: Can individuals with autosomal recessive disorders pass it on to their children? Answer: Yes, individuals who are carriers of an autosomal recessive disorder can pass it on to their children. Question: Is there a way to prevent autosomal recessive disorders? Answer: Genetic counseling and carrier testing can be used to identify individuals who may be at risk of passing on an autosomal recessive disorder, and prenatal testing can be used to diagnose the disorder during pregnancy. Question: Are autosomal recessive disorders rare? Answer: Autosomal recessive disorders can vary in frequency depending on the specific disorder and the population being studied, but some autosomal recessive disorders are considered rare. Question: Do all autosomal recessive disorders have similar symptoms? Answer: No. The symptoms of autosomal recessive disorders can vary widely depending on the specific disorder and the gene involved. Question: Are autosomal recessive disorders more common in certain ethnic groups? Answer: Some autosomal recessive disorders are more common in certain ethnic groups due to the presence of specific genetic mutations that are more prevalent in those populations. Question: How do autosomal recessive disorders differ from autosomal dominant disorders? Answer: Autosomal recessive disorders require two copies of a gene to be altered in order for the disorder to manifest, while autosomal dominant disorders only require one copy of the gene to be altered. Question: Can autosomal recessive disorders be inherited from just one parent? Answer: No. Autosomal recessive disorders require two copies of the gene to be altered, one from each parent. Question: What is the difference between a carrier and an affected individual for autosomal recessive disorders? Answer: A carrier has one altered copy of the gene and may not show symptoms of the disorder, while an affected individual has two altered copies of the gene and will show symptoms of the disorder. Question: Can individuals with autosomal recessive disorders lead normal lives? Answer: This can vary depending on the specific disorder and the severity of symptoms, but many individuals with autosomal recessive disorders are able to lead normal lives with proper treatment and management. Question: Are autosomal recessive disorders more common in males or females? Answer: Autosomal recessive disorders affect males and females equally.
Thank you for watching our Q&A format video. We hope this helped you learn, review, and retain knowledge needed for the USMLEs. For more information on this topic, check out the link in the description. Now, if you want to take your USMLE prep to the next level, be sure to check out all our courses, which are structured to follow along with the first aid for the USMLE Step 1 book. You can find us at usmleqa.com. And if you're watching this on YouTube, be sure to like and subscribe.